What I'm about to tell you could completely change the way you look at those two little pills sitting in your weekly organizer right now. Because if you are a senior taking amlodipine and losartan together, there is something you need to understand immediately. This combination is prescribed every day, and for many people it works well. But when the side effects start, they often do not feel like side effects at all. They feel like aging. They feel like weakness. They feel like poor sleep, bad balance, swollen feet, or a heart that just doesn't feel quite right anymore. And that is exactly why so many older adults miss the warning signs until the situation becomes frightening. Now listen carefully, because this is important. This is not a message to stop your medicine on your own. Never do that, not with blood pressure medication. If your doctor prescribed amlodipine and losartan together, there may be a very good reason. One relaxes blood vessels through one pathway, the other blocks a pressure-raising hormone system through another, and together they can lower blood pressure effectively. But effective does not mean harmless, especially after 60, when your kidneys may be more sensitive, your balance less forgiving, and one day of dehydration can change how your body handles the exact same dose that felt fine the week before. And here is what worries me most. Many seniors do not get into trouble because they took the wrong medicine. They get into trouble because they kept taking the right medicine while ignoring what their body was desperately trying to tell them. A little ankle swelling becomes massive by evening. A little dizziness becomes a fall in the bathroom at 3 a.m. A little weakness becomes an emergency room visit after blood pressure drops too low or potassium climbs too high. By the end of this video, you are going to know the 7 side effects this combination can cause, why they happen, which one is the quietest but most dangerous, and what signs should never be brushed off as just getting older. Before I show you side effect number 7, I need you to understand something that changes everything. Amlodipine and losartan do not usually hurt seniors in one dramatic moment. They do it slowly, subtly, almost politely, at first. Amlodipine relaxes blood vessels, which can lower pressure, but also lets fluid shift into tissues, and can trigger swelling, flushing, and palpitations. Losartan blocks angiotensin II at its receptor, which helps pressure come down and can protect the kidneys in some people, but it also changes how the body handles fluid balance and potassium. Put them together, and you can get good blood pressure control, yes, but you can also magnify side effects that make an older adult feel unstable, weak, foggy, or falsely reassured. So let's begin with side effect number 7, because this one is usually the first to show up and one of the most ignored. Side effect number 7 is swelling in the ankles, feet, and lower legs. Not mild puffiness you barely notice. I mean that strange end-of-day heaviness where your socks leave deep marks, your shoes feel tighter at dinner than they did at breakfast, and your legs suddenly look older, fuller, and more tired than they did a month ago. This is most strongly associated with amlodipine. It relaxes the small arteries very well, but the fluid return through the venous side does not always keep up, so fluid seeps into the surrounding tissue. What makes this side effect emotionally powerful is that it frightens people. A senior looks down and thinks, is this heart failure? Are my kidneys shutting down? Is something seriously wrong? And then, instead of calling the doctor, many do something much more dangerous. They start skipping doses. Maybe not every day, maybe just on church mornings, travel days, family events, or when they know they'll be on their feet. That decision feels logical in the moment. If the medicine seems to be causing the swelling, just take less of it, right? But then blood pressure starts rising again in the background, silently, while the person feels proud for solving the swelling problem. Here is the truth. Swelling from amlodipine does not automatically mean the medicine is harming your heart. It often means the medicine is doing exactly what that class of drug does in the blood vessels. And your doctor may be able to adjust the dose, timing, or overall regimen. Sometimes the solution is simple, sometimes it is not. But the danger is silence. The danger is hiding the symptom and changing the dose on your own. If swelling is new, getting worse, or paired with shortness of breath, chest discomfort, or rapid weight gain, that is a call your doctor situation. Not because every case is an emergency, but because older bodies do not give you many safe chances to guess wrong. Now, side effect number 6 is the one that causes seniors to lose confidence in their own body. It is dizziness and lightheadedness. And I want to be precise here because people use those words casually, but they are not casual at all. I'm talking about that odd floating feeling when you rise from bed, the room not exactly spinning, but not exactly staying still either, the need to grab the counter after standing up, the little pause you suddenly need before walking into the kitchen. Both amlodipine and losartan can contribute to this. When blood vessels relax and pressure falls, especially in a senior whose balance is already fragile, standing can become a physiologic challenge. Mayo Clinic's guidance on both medicines warns about dizziness, lightheadedness, and even fainting. And that matters because dizziness in older adults is not just uncomfortable. It is mechanically dangerous, the way a loose stair railing is dangerous. The symptom itself may pass in seconds, but the consequences of one unstable second can be enormous. One hand misses the nightstand, one foot catches a rug, one hip breaks, one head hits a tile floor. That is how a side effect becomes a life-changing event. And what makes it worse is that many seniors do not connect it to medication because it seems to happen only occasionally, usually when getting up too fast. Let me tell you what often happens. A senior feels fine sitting down. Blood pressure seems controlled. Then after a hot shower, a warm day, a missed lunch, or a restless night, the exact same dose suddenly feels stronger. Why? Because your medication is not working in a vacuum. It is working inside a body whose hydration, salt balance, appetite, kidney function, and circulation may change from day to day. The result is inconsistency, and inconsistency is what confuses people. They think, if it were the medicine, wouldn't it happen every day? Not necessarily. That is the trap. Medication side effects in seniors often depend on conditions around the medication, not just the pill itself. And that leads us to side effect number 5, the one families notice before the patient does. Side effect number 5 is unusual fatigue, sleepiness, or heaviness in the body, not ordinary tiredness after a busy day. I mean that strange, low-energy feeling where walking across the house feels like more effort than it should, where afternoon drowsiness arrives like a curtain, where motivation drops and everything feels just a little slower, softer, and harder. Amlodipine is known to cause tiredness and drowsiness in some people, and losartan can contribute to fatigue too, especially if blood pressure is being pushed lower than the body likes or fluid status is off. This is one of the most misread side effects in senior health. Because fatigue has so many possible explanations, it gets filed away mentally as age, weather, poor sleep, stress, grief, boredom, or just one of those things. But if the fatigue appeared after starting the combination, after a dose increase, or after another medication was added, you cannot assume it is random. The body often tells the truth quietly before it ever screams it. And when seniors ignore that quiet message, they sometimes compensate in ways that make everything worse. They move less. They drink less. They cancel walks. They stay in chairs longer. Blood pressure may look controlled, but strength, conditioning, and confidence begin slipping away. What I want you to remember is this: controlled blood pressure is not the same thing as feeling well. The goal of treatment is not to turn a senior into a person who is technically stable on paper, but too exhausted to enjoy life, too sleepy to socialize, or too weak to stay active. If this combination leaves you feeling flattened, dulled, or unlike yourself, that deserves a conversation. Not panic and not self-discontinuation, but a real conversation. Because when fatigue is medication-related, families often wait too long, thinking they are being respectful by not complaining. Meanwhile, the older adult quietly loses ground week by week, and everybody blames aging instead of the regimen. Now, side effect number 4 is the one that scares people because it feels like the heart itself is protesting. Side effect number 4 is a pounding heartbeat, fast heartbeat, or palpitations. Amlodipine's official labeling includes palpitations and flushing among reported side effects, and losartan guidance also mentions that some serious reactions can involve fast or irregular heartbeat. which is why you should never casually dismiss a heart that suddenly feels noisy, forceful, jumpy, fluttering, or strangely aware of itself. For some seniors, this is brief and harmless. For others, it is the clue that blood pressure has dropped, electrolytes are off, or the body is reacting badly to the current setup. This is where fear really starts taking over. A senior lies down at night and suddenly becomes aware of every beat. The chest is not necessarily painful, but it feels different, more dramatic, more present, more impossible to ignore. And the mind begins racing. Is this anxiety? Is this atrial fibrillation? Am I about to have a heart attack? Sometimes the sensation passes in minutes. Sometimes it returns every evening. Sometimes it appears after a dose increase or when the person is overheated, dehydrated, or using another medication that changes how the blood pressure pills feel. The problem is not just the symptom. The problem is the uncertainty. Uncertainty makes people hide symptoms or take extra readings and frighten themselves even more. I want to be very clear here. A brief palpitation is not automatically a catastrophe. But palpitations combined with dizziness, fainting, chest discomfort, shortness of breath, or weakness should never be minimized. In older adults, rhythm sensations can be the first clue that something deeper is wrong. Sometimes the blood pressure has fallen too much. Sometimes potassium is off. Sometimes another condition is present and the medication has unmasked it. You do not need to diagnose that yourself. You just need to respect it. The mistake is assuming that because blood pressure medicine is common, any symptom that happens while taking it must be ordinary. Common medicines can still create uncommon danger in the wrong body on the wrong day. Now we move to side effect number 3, and this is where things begin getting more serious. Side effect number 3 is fainting, near fainting, or blood pressure dropping too low. Not just mild dizziness, but that cold wave where your vision dims, your knees soften, your body feels hollow, and for a second you know you may go down if you do not sit immediately. This can happen with blood pressure medication in general, but the combination of amlodipine and losartan deserves special respect in seniors because two separate mechanisms are working to lower pressure at the same time. That is good when carefully managed. It is dangerous when hydration changes, appetite drops, or another illness enters the picture. This is the side effect that often shows up during perfectly ordinary life. A senior gets out of bed too quickly, stands after lunch, walks outside on a warm day, takes a hot shower, climbs stairs after not drinking enough water, or wakes with a stomach bug, but still takes the usual pills anyway, because I never miss my medicine. That sentence sounds disciplined, but during illness it can become dangerous. Medline Plus and Mayo Clinic both warn that vomiting, diarrhea, sweating heavily, or not drinking enough fluids can push losartan users toward low blood pressure and fainting. And when amlodipine is on board too, the body may have even less room to compensate. What makes low blood pressure so deceptive is that many seniors are taught to fear only high numbers. High blood pressure is the villain everyone recognizes, but pressure that falls too far, too fast, or at the wrong moment can be just as destructive, especially because it causes falls, confusion, weakness, and poor blood flow to organs. A person can be thrilled that their readings look lower while their actual body is sending distress signals. They may say, "My blood pressure has never been better," even as they are holding on to walls, sleeping more, and feeling less steady by the week. Numbers can fool you if you only respect the monitor and ignore the symptoms. So if you are taking this combination and you develop faintness, near fainting, or sudden weakness, especially during illness, heat, poor intake, or after standing, do not just power through it and do not assume it will sort itself out. The right response may be as simple as a medication adjustment, hydration guidance, or temporary sick day instructions from your clinician. But those instructions need to come from the person managing your care, not from guesswork. Seniors get into trouble when they treat blood pressure medication like a rigid rule instead of a treatment that exists inside a changing body. A body with diarrhea is not the same body. A body in August heat is not the same body. A body after poor sleep and little food is not the same body. And now we arrive at side effect number 2, the one most people never feel until it is already affecting something vital. Side effect number 2 is kidney stress, worsening kidney function, or in some cases, acute kidney injury, especially when dehydration or certain pain relievers enter the picture. This is where Losartan deserves enormous respect. Official prescribing information warns that changes in renal function, including acute renal failure, can occur in certain patients. That does not mean Losartan is a bad drug. It means it is a powerful drug working on a powerful system, and the kidneys are one of the organs most sensitive to changes in blood flow, fluid status, and pressure. Here is why seniors miss this. The kidneys do not always complain dramatically at first. They do not send obvious pain signals like a bad knee or a tooth infection. They just work less well. Maybe the person becomes more tired. Maybe appetite changes. Maybe swelling seems worse. Maybe blood work at the next visit reveals a problem nobody suspected, because nothing felt urgent enough to call about. And this risk rises when three things collide: a blood pressure lowering drug like Losartan, dehydration from vomiting or diarrhea or poor intake, and over-the-counter NSAID pain medicines like ibuprofen or naproxen. That combination can reduce kidney blood flow at exactly the time the body can least afford it. This matters because many seniors do not think of over-the-counter pain relievers as real players in the story. They think, it's just something for my back, or it's only what I take for my knees. But Losartan guidance specifically warns about interacting with NSAIDs. And if kidney reserve is already reduced with age, the margin of safety may be thinner than people realize. Add summer heat, a poor appetite, a few days of stomach upset, or the decision to drink less so I don't have to use the bathroom so often. And suddenly the kidneys are being asked to work under stress while the medicine keeps doing what it was designed to do. That is how a quiet side effect becomes a serious lab abnormality. Let me put this as plainly as I can. A senior can take Amlodipine and Losartan for months and do beautifully, then get a short illness and suddenly become unstable. That does not mean the treatment was wrong from the start. It means the body changed and the plan needed to change with it. If you cannot keep fluids down, if you are vomiting, having diarrhea, barely eating, sweating heavily, or feeling unusually weak, do not assume your normal medication routine should continue unchanged. Call your doctor. Ask for sick day guidance. And if you regularly use ibuprofen, naproxen, or similar pain relievers, that needs to be discussed too. A pill that felt harmless to your knee may not be harmless to your kidneys inside this combination. And now we come to side effect number 1. This is the one I most need you to remember because it can be almost completely silent until it becomes dangerous. Side effect number 1 is potassium rising too high in the blood, hyperkalemia. And if that word sounds technical, stay with me because the actual idea is simple and frightening. Potassium is one of the minerals that helps control the electrical rhythm of your heart. Losartan can increase potassium levels, not in every patient, not every time, but enough that official prescribing information tells clinicians to monitor it. And when potassium rises too high, the heart's electrical system can become unstable. That means weakness, cramps, odd beats, or in serious cases, a dangerous rhythm problem. Why is this the most dangerous side effect in this countdown? Because unlike ankle swelling or obvious dizziness, high potassium often does not make a dramatic entrance. A senior may feel a little weaker. Maybe the legs feel heavy. Maybe there are mild cramps. Maybe the heartbeat feels strange for a second. Maybe there is nothing obvious at all until a blood test catches it or the rhythm becomes abnormal. That is what makes it so different from the other side effects. It can hide in plain sight. And the saddest part is that many people unintentionally make it worse while trying to be healthy. They swap regular salt for potassium-based salt substitutes. They drink electrolyte products. They use heart-healthy seasoning blends without reading labels. Medline Plus explicitly warns Losartan users not to use salt substitutes containing potassium unless the doctor says it is okay. And Mayo Clinic also warns patients to ask before using potassium-containing supplements or substitutes. That is not a small footnote. That is a major senior safety issue. Because a person can be highly disciplined, highly motivated, trying sincerely to protect the heart, and accidentally push potassium higher while taking a drug that already raises the risk. They are not careless. They are uninformed, and uninformed seniors are often the most vulnerable ones because they believe they are doing everything right while the problem builds invisibly. Think about how this plays out in real life. A senior is told to reduce sodium. Good advice. So they buy a salt substitute. They start using meal replacement drinks. They drink electrolyte support powders after walking. They keep taking Losartan, maybe with Amlodipine, and nobody ever explains the potassium issue clearly enough. And now the body is carrying a burden it never asked for. Then come the symptoms: unusual weakness, a skipped beat, fatigue that feels oddly muscular, maybe a sense that the legs are not responding with their usual energy. Those symptoms are vague enough to ignore and serious enough to matter. That is the exact combination that hurts seniors. Vague enough to dismiss, serious enough to punish dismissal. And here is what makes side effect number one the one I fear most. It is not only about comfort, it is about electrical stability. The same heart that has carried you through stress, grief, work, family, surgeries, winters, and sleepless nights depends on a delicate chemical balance to beat normally. And potassium is part of that balance. Too low is bad. Too high can be dangerous. The reason this side effect deserves the top spot is not because it is the most common thing everyone will feel. It is because it is one of the easiest serious problems to quietly walk into if nobody taught you what to watch. And once again, the danger is not the existence of the medicine. The danger is taking it blindly. So, what should you do if you are a senior taking amlodipine with Losartan? First, do not stop the medicine on your own, no matter how dramatic this title sounded when you clicked it. That would be the wrong lesson. The right lesson is to stop taking the combination casually. Stop taking it without understanding it. Stop taking it while ignoring swelling, dizziness, weakness, palpitations, faintness, dehydration, kidney stress, and potassium risk. Second, know your body's baseline. If your shoes suddenly fit differently, if your balance changes, if standing becomes harder, if you feel abnormally drained, if your heart feels irregular, that information matters. Third, talk to your doctor or pharmacist before adding potassium products, salt substitutes, or regular NSAID pain relievers. Fourth, respect illness. If vomiting, diarrhea, low appetite, fever, or heavy sweating enter the picture, the body that handled this medication yesterday may not handle it safely today. And that is exactly when seniors need guidance rather than stubbornness. Fifth, get the blood work your clinician recommends. Kidney function and potassium are not details. They are part of safe prescribing. Sixth, take symptoms seriously, even if your blood pressure numbers look good. A pretty reading on a home monitor does not overrule a body that feels unstable. And seventh, if you are caring for a parent or spouse on this combination, watch for the quiet changes. Family members often notice slower walking, swelling, fatigue, or confusion before the patient admits anything is wrong. Let me bring all 7 side effects together for you clearly. Number 7, ankle, foot, or leg swelling. Number 6, dizziness and lightheadedness. Number 5, unusual fatigue, sleepiness, or body heaviness. Number 4, pounding, fluttering, or irregular heartbeats. Number 3, fainting, near fainting, or pressure dropping too low. Number 2, kidney stress, especially when dehydration or NSAIDs get involved. And number 1, high potassium, the silent side effect that can disturb the heart's rhythm, sometimes before you realize anything serious is happening. If you remember nothing else from this video, remember this. The side effects that do the most damage in seniors are often the ones first mistaken for ordinary aging. I want to end with one truth that almost nobody explains well enough. Blood pressure treatment is not just about lowering a number. It is about protecting a life, without shrinking that life in the process. If your medicine lowers the reading but leaves you swollen, weak, frightened, dehydrated, unsteady, or unaware of serious potassium and kidney risks, then the conversation is incomplete. Not hopeless. Incomplete. And incomplete information is dangerous in older adults because older adults do not have the same margin for error. One fall matters more. One skipped meal matters more. One stomach virus matters more. One over-the-counter painkiller matters more. One healthy salt substitute matters more. So if you or someone you love is taking amlodipine with losartan, do not panic. Do not self-diagnose. And please do not throw the pills away in fear, because fear is not the goal here. Clarity is, awareness is, safe action is. Ask the right questions. Notice the right symptoms. Respect the right warnings. That is how seniors stay protected. That is how medication becomes a tool instead of a trap. And that is how you avoid becoming the person who says, weeks from now, I thought it was just aging. It was not just aging. It was your body asking you to pay attention. Take care of yourself. Stay alert to these 7 side effects. Talk to your doctor before making any medication change. And I'll see you in the next video.